they'd been in the car or had gotten hurt. Oh.
Sorry. Well, nothing seems to be broken. Those soft tissue injuries are common after a car collision. I can give you something for the discomfort.
No, this is nothing new. I've had back pain for years.
Okay, can I just see your hands? Sure. It's not too bad. Still, we should do some imaging. Is there someone we can call?
Oh, my husband's on his way.
Great.
Excuse me, doctor. I'm Jason, Sonia Jessup's husband.
Bashir Hamed.
She said she was rear-ended. Is that true?
Yes.
And she's okay?
We're running some tests to make sure.
Dr. Hamed, did Sonia ask you for painkillers?
She's managing fine.
If she does ask for some, please don't give her any.
Sir?
My wife's an opioid addict. She's been clean 6 months. It's important you don't even offer her any. Thank you.
Thanks. Does this CT look normal to you?
Yeah. Yeah, I didn't think your patient sustained head trauma.
Doesn't seem like it from her scan, but she passed out during a physical exam and her respirate's low.
You have a theory?
Her husband just told me she's had problems with opioids.
Did you run blood work?
Labs aren't back yet, but according to her chart, she was here a couple of times 8 months ago requesting narcotics for back pain. The last doctor she saw here wouldn't prescribe any.
Did she ask for any today?
No, even though she's clearly in pain.
She probably knows that she's flagged. Doesn't want to draw attention to it. Decreased respirate, losing consciousness, no head trauma?
Her husband said she's clean now.
Still, kind of tough to ignore what those symptoms are saying.
That she's using again?
Why weren't you moving if the light turned green? You're always the one honking to go before it even changes.
It was green barely a second before she hit me.
Good news, your CT came back negative for any head injury.
Great, but if she didn't actually hit her head, why did you check it?
He's just being thorough.
I'll give you guys some space.
No, please. What aren't you telling me?
Nothing.
Sonia?
I passed out earlier.
You passed out? In the accident?
No, when I got here, and I didn't want to tell you because I didn't want you to worry.
Are you using again?
No, Jason. I swear.
Then why didn't you tell me you passed out? Why lie?
Because I was afraid you're gonna jump to this exact conclusion.
Or because you were high, and that's why you didn't see the light change?
No, I wasn't. I was distracted for like a second, and then she slammed into me.
You drove the kids this morning. Did you get high and drive the kids?
No, Jason. You have to believe me.
How can I? After everything we've been through.
Because I wouldn't do that.
Except you have. When you picked up Tessa from dance.
Her carpool got messed up, and she was by herself.
Excuses, my God.
Look, I know things were messed up, Jason, but I swear to you I wouldn't do that again.
But you did. You knew this was your last chance. God, I should have seen it. You've been distant lately, barely present.
Yeah, because I've been in pain. I wasn't using. I wanted to, Jay, but I didn't. I didn't even ask the doctor for painkillers.
That doesn't mean you didn't take something before. That's what you're waiting for the test results to prove, right?
The labs can tell us a number of different things.
You promised me we were done with this! You're out of chances.
Jason, don't do this. Just...
Don't come home tonight. I don't want you around our kids anymore.
Jason, wait! Oh, I'm gonna be sick.
I'll get you on fluids.
I don't need fluids.
We have resources that can help you. There's a detox
No!
on staff. I can get you Suboxone for withdrawal.
I said no! I don't want your help. A doctor like you gave me pain meds in the first place and got me into this mess.
I'm sorry. I'll be back with your lab results.
Hey, Bash. Bishop asked me to cover for your patient, said you had to step out. Are you okay? Is everything okay?
Everything's fine. Did Sonia Jessup's blood work come back?
Yes, but not before she left. A nurse tried to stop her, but she wouldn't stay.
I wish she'd change her mind. Let us get her some help.
Actually, she didn't have any opioids in her system.
You're saying Sonia wasn't using?
Blood work was clean, yeah.
I tried treating her for withdrawal. I I didn't believe her. No wonder she didn't stay.
It was a reasonable assumption to make.
Yeah, but that means there's something else wrong with her.
33-year-old woman collapsed in a coffee shop. She was unconscious when we arrived. We administered naloxone at the scene.
Sonia Jessup, she overdosed? Do we know what she took?
BP's dropping, heart rate's 145.
She's in VTech.
Well, she shouldn't be. I mean, heart rate decreases after an overdose. Isn't this your car accident victim that walked out AMA this morning?
She lost consciousness during a physical exam and her rest rate was low, but she wasn't on opioids then. Muffled heart sound. Scan.
Cardiac tamponade.
She needs a pericardiocentesis. We need to drain the fluid around her heart.
Okay, do it.
I need an 18-gauge, 7-centimeter needle with a 30cc syringe.
Got it?
I see the trajectory. Claire, keep the field in view.
Use a subxiphoid approach and aim towards the left shoulder.
Sats are falling.
I don't feel it yet.
Okay, go easy. You're not quite in.
Got it.
She's stabilizing.
I let her leave. This is on me. Jason, you should also know that there were no opioids in her system this morning.
Well, you're saying she wasn't high when she drove the kids? Well, that means she only went and used after I accused her. This isn't my fault. I told her not to come home. She could have died.
But she didn't. She's sedated right now, but you'll be able to see her soon. Okay?
Okay.
Hi. Your husband was just here.
He's making arrangements for the kids.
I didn't believe you, Sonia. I'm sorry.
Well, it turns out you were right not to.
You stopped once. You can stop again.
Yeah, but the pain never goes away. One bad moment sends me over the edge. I know my family keeps hoping that this is over, but it's never over. Now when I look at my life, all I see is this void. This giant void.
You have to face it.
But what if I can't? What if I'm not strong enough?
But you are.